Welcome back to East Texas Live on KETK. October is Breast Cancer Awareness Month, which is an annual campaign to increase awareness of the disease. While most people are aware of breast cancer, many forget to take the steps to have a plan to detect the disease in its early stages and encourage others to do the same.
We're joined now with a breast cancer nurse navigator, Ronna with Ross Breast Center at Trinity Mother Francis. Nice to have you here. I jokingly said you're not an Obamacare navigator, you're a nurse navigator. There's all the difference in the world there. Nice to have you with us. You and I were talking earlier, you've been doing this for quite some time, and I get to speak with people like you and of course Dr. V and a lot of other researchers and doctors who say we have come light years in the treatment of breast cancer, just light years in just a few years. It's been amazing, hasn't it?
Definitely. Breast cancer has come a long way as far as detection and treatment. It's a curable disease. It is not something that's a life.
No longer a death sentence.
No longer.
Now, what role do you play as the breast care nurse navigator?
I'm a true patient advocate. I sit with the doctors when the patient comes in for a diagnosis, and then I'm able to help to navigate them through the myriad of appointments that they have and procedures that they might have.
Well, it's obviously the diagnosis itself is overwhelming. It's like getting hit with a rock, I'm sure, but you're there to hang on with them, and there is strength in numbers here. Talk about the importance. I mean, we preach early detection is key. Talk about how important that is.
Oh, it's life-saving.
Yes, literally. Yes.
Exactly. A lump can be detected in the breast up to 2 years earlier than you could actually feel it with mammography now, and so that makes it, life-saving.
We talk about the misconceptions or misunderstandings about breast cancer that some people you've seen happen.
Right. I guess one of the big misconceptions is the fact that you have to have a family member with breast cancer to be diagnosed with breast cancer. That's your only risk, and that's not true. Up to 70 to 80% of the patients that are diagnosed never have a family member that has breast cancer. So it's not only familial. The familial part is very insignificant.
So really anyone could have it. That's why you got to check up on it.
Yeah, we've all known someone or relations or friends or family or someone close to us who has been affected by this. Tell us a little bit, give us kind of a quick little grand tour of the Ross Breast Center. What services are you folks able to provide there? Okay,
we have screening mammography, of course, that's a big part of it, and screening mammography all over East Texas with the mobile van and at different clinics at Trinity Mother Francis, as well as in the Ross Breast Center itself in the North Park building. We do diagnostic mammograms and ultrasounds and biopsies to get to the bottom of any kind of breast disease that you might have.
So it is smart to check just in case, right? People go in and check and see how their body's doing.
Right. At age 40, you should start. Everybody should get a mammogram at age 40.
You mothers mothers are always saying, well, I got to get, you're busy taking care of everybody else. Moms, take a moment and take care of yourself. Be selfish for just once, would you? Thank you for coming, Ronna. Nice to see you.
Thank you.
And again, all this month we'll be thinking about that and what you guys do, and thank you for the efforts of everybody there.
All right, thank you.
Thank you.
Welcome back to Fox 51 today. October is Breast Cancer Awareness Month, which is an annual campaign to increase awareness of the disease. While most people are aware of breast cancer, many forget to take the steps to have a plan to detect the disease in its early stages and encourage others to do the same. We're joined now with physician Dr. Evan Evans from Trinity Mother Francis. Good morning, and thank you for joining us.
Thank you for having me.
So this is a very, very important month to bring awareness to breast cancer. We've actually had people that have worked here that have had it before. Why is it so important to highlight this disease?
Well, unfortunately, breast cancer is a very common disease. This year in the United States, approximately 190,000 women will be diagnosed with invasive breast cancer, and another 60,000 women with an earlier form of breast cancer called intraductal carcinoma. It's a very common disease. Over a woman's lifetime, she has a 1 in 8 risk of developing breast cancer.
And so you need to get those screenings. How important is it to get those screenings to detect this breast cancer?
Screening is very important. We recommend that screening mammography begin for all women at age 40 and continue yearly for the rest of her life. Screening detected breast cancer has a significantly higher cure rate than does a cancer diagnosed clinically, which is usually a lump that a woman or her doctor palpates within her breast.
And now, I mean, there does seem to be some misconceptions about breast cancer. I actually have a friend and her father who had breast cancer. What are some of those misconceptions?
Well, probably the most common misconception is that breast cancer only occurs in families that have a history of breast cancer, when in fact 75% of women who are diagnosed with breast cancer have no family history. Male breast cancer is much more rare than breast cancer in women, which is common, but it does occur, so men should be aware of any changes in their own chest or breast, a palpable lump usually.
And now Trinity Mother Frances has the Ross Care Breast Center, and I see you guys out all the time, and you are always holding events trying to bring awareness to this. What exactly do you guys do over at the Ross Care Breast Center?
Well, we are a comprehensive breast center. We, of course, offer screening mammography, but we also offer diagnostic mammograms, which is a clinically oriented breast evaluation for women who have signs or symptoms that could be the result of breast cancer. We also are very proactive in assessing a woman's own personal risk of breast cancer, and when appropriate, we do recommend adjunct screening tests such as whole breast ultrasound or occasionally breast MRI for women in whom a screening mammogram may not be enough to find an early breast cancer.
Now, if we're wanting to find out more information about the Ross Care Breast Center or Trinity Mother Frances, where can we find that information?
We have a website, rossbreastcenter.com, and we encourage all women to visit our website to find out more about us. And we do have a nurse navigator, Ronna Best, who's a tremendous advocate in breast cancer diagnosis and also assists women who have been newly diagnosed with breast cancer through the treatment process.
Well, thank you guys so much for everything you do. You guys have a very talented staff, and we always encourage our viewers to go get tested and to go get treated. Thank you so much.